Welcome to the Deep Dive. We're here to cut through the noise, get right to what matters. And today we're really plunging into a challenge it's straightening our healthcare system right at its core. It's this huge administrative load that doctors, nurses, everyone are carrying. It's all this paperwork, complex rules. It just pulls them away from why they got into medicine in the first place, helping patients.
Yeah, so for this deep dive, we're drawing insights from excerpts of Reclaiming Physician Time with Virtual Assistants. Our goal here is really to unpack how this burden hits physicians and, maybe more importantly, look at a specific solution that's starting to emerge. Something practical. Let's maybe start with an example. Picture someone, let's call her Dr. Carter, super dedicated doctor, days are just a blur, patient after patient.
Right, that classic whirlwind of care.
Exactly. But then, according to our sources, her evenings, they're just swallowed up by this mountain of admin work.
Ah, the paperwork pile.
Yeah, endless notes, getting insurance verified, managing all those patient portal messages, fighting billing issues.
It's relentless. It really is.
Yeah.
And the sources say, the actual joy of medicine, it gets buried under all that grind. She ends up feeling drained, disconnected from her life. It paints a pretty tough picture.
And Dr. Carter's story, it's really not an outlier.
No, sadly.
Across the whole country, physicians are just, they're drowning in these admin demands. Things like chasing insurance approvals, which can be incredibly complex.
Right.
Or just managing appointment schedules, fielding patient questions. These aren't small things. They constantly chip away at a doctor's time. And honestly, their energy, their well-being. Which leads us to that word we hear a lot, burnout.
Yeah.
The sources are clear. This isn't just some trendy term. It's a genuine crisis growing in healthcare, and it directly pulls energy away from patient care.
Okay, so if that's the problem, and it sounds pretty widespread, how are some people managing? Our sources mention another physician, Dr. Anita Juncan. She has a similar caseload, just as demanding.
Right.
But her experience, apparently, it's strikingly different.
Okay, how so?
Well, this is where the solution comes in. She's supported by a virtual medical assistant from Staffingly, Inc., according to the material. So what does that actually look like day to day, having that virtual support?
Yeah, let's break that down.
Imagine Dr. Nguyen's assistant handling prior authorizations, getting the green light from insurance before a procedure.
Which can be a huge time sink. Huge.
Definitely. And they're also updating the EMRs, the electronic medical records, keeping everything current.
Essential but tedious work.
And coordinating schedules, chasing down unpaid bills, stuff that eats up so much time.
Right. And the key thing here...
It's all done remotely, from a virtual workstation somewhere else.
And the impact of that, it's actually quite profound when you think about it. By outsourcing these tasks, the ones that are really repetitive, time-consuming, but maybe don't require the physician directly, providers like Dr. Nguyen, they get to rediscover sort of the heart of their job. Caring for patients, directly interacting, diagnosing, treating. For Dr. Nguyen specifically, the sources say her energy goes to patients, not admin.
It makes sense.
And her evenings, they're hers again. She's not chained to the computer finishing paperwork.
That sounds like a game changer.
It really is. And looking bigger picture, this isn't about finding ways to work even harder.
Right.
It's about working smarter. This admin overload, it shouldn't be seen as inevitable.
Right. Just the cost of doing business.
Exactly. It's more a sign that the systems haven't kept up. They haven't adapted to how complex healthcare is now.
So pulling it together from these sources, the main takeaway seems to be, that companies like Staffingly are offering this trained, reliable, virtual support.
Yeah.
And it does more than just streamline things. It genuinely seems to cut down stress, bring back some balance for doctors.
Absolutely. It recalibrates their whole day, their whole focus.
Which brings us back to that core idea. Using virtual assistants lets doctors break free from that administrative chaos so they can actually focus on what matters most, on healing. So as we wrap up this deep dive, the insight seems pretty clear, right? We have this specific solution, virtual medical assistants, that's directly tackling a massive problem. Physician burnout driven by just too much admin.
Precisely. And it's not just about making things a bit more efficient here and there. It's a fundamental shift, really. It lets doctors, nurses, all medical professionals truly focus on what they trained for.
What they're passionate
Right,
about.
exactly. And what patients really need, that focused, present, empathetic care.
And maybe that leaves us, and you listening, with a final thought to chew on. What does it really mean for the future of healthcare?
If you are looking for outsourcing services, schedule a demo today.